So today we're going to look at a sprained ankle. Now most therapists know to treat an ankle by elevation, ice and to strap it. But the problem with that is that the tendons are still out of line. So today we're going to look at putting those tendons back in place and then it can be strapped after that. So here we are with Rowena's ankle, and most of the time when an ankle's twisted it's a little bit lower, but in this case it's up quite high. So as we can feel here, the third toe has the tendon jumping over onto the fourth tendon. So we're going to put this across here and it's going to jump back into its groove. So you might actually be able to hear this. We just locate the tendon and using a bit of force, there it goes there. So you could actually see that jump over. And we just hold it there, give it a bit of a rub, and you can see now we can go across and it's not jumping over. So the difference between choice point technique and other massage therapies is that we're actually putting the tendons back in place. Now if you take an example with the fingers, if you cross your fingers together and start to move them back and forwards, you can feel the tension in this joint. Now you can massage that and trigger point it and it will start to feel good, but as soon as you start to move that finger back and forwards again, that tension starts from the joint. So the idea is to put the tendons back in line, and as soon as they start moving, it takes the pressure off. So if we have a look at the rhomboids here, and this is a classic area of tension, and how it can pull right up onto the neck and shoulders, and onto the shoulder blade, and onto the discs. So if we bring the camera in, we can see this whole area moving back and forwards. And to give you an example of what's going on underneath the skin, if we just pop a towel over, in effect what's happening is they're twisting up. So you can see the tension in the towel as I twist it, where the pulling's coming from. So we're going to, by using our thumb, flick those over and put them back in line. Okay, so we're going to locate the muscle that's caught up here, and we're going to peel it back, drawing the skin back, and we're going to push it forward and it will flick out. So if we grab this here and pull back, and you see it jump over there. Now there's a little bit more going on up here that you probably won't see jump up. Grab that. And there's a little bit under there. So now if we rub our hand over it, you can see it's as smooth as the other side. So now we're going to look at the most common problem that people have, which is neck and shoulder pain. We've got Huia here who's just been to Spain and sustained an injury at the running of the bulls. So if we look here with the tendons, they've been caught up around the shoulder blade and then up around the neck here as well. So if we put some pressure on, we can really see the tension in his shoulders. So we're going to start from the edge of the shoulder and we're going to go up along the groove. Feel it go there, and another one there, and come up and back around. I'm just going to put this over in the neck. we go. Just hold that there. Now if we look at the shoulder, it's gone all soft.